Hi, Dr. Sasse here from Nevada Surgical. Happy 2023. I was asked recently to give a little bit of a recap about what's the state of the art for weight loss therapies from the kind of evidence-based world, from the medical world, the world we live in. So I'll just give a quick rundown. There have been a few changes, a few improvements in 2022 that are worth mentioning. Let's start on the diet and exercise front. I wish we had big breakthroughs there. By my lights, I don't see big breakthroughs there. There is some evidence that intermittent fasting does have some value. It does appear to activate some of the biochemistry that we think is favorable in terms of reducing long-term blood sugar and some of the hepatic fat storage. And there may be some helpfulness to that strategy. So, we're all for it whenever we can find ways to improve the weight trajectory to a more healthy place through any kind of non-invasive means. So even intermittent fasting, where it's only a 12-hour fast, this may be helpful. Trying to do this several times a week is likely to be somewhat helpful. Aside from the data about intermittent fasting, I don't see things, at least on my radar, that appear to be highly effective other than the sort of long-term overall big picture trajectory, which is that we should all be taking in less carbs, so less sugar, less processed sugars, less desserts, less sugared beverages certainly, less sweets, breads, crackers, crusts overall. That still remains the long-term best strategy in terms of diet. Then in terms of exercise, just like diet, there's a mountain of research that is produced every year, some of which may have some long-term implications, but we don't see something that's really game-changing other than that more exercise is clearly better than less exercise. And so for the vast majority of us who need to exercise more and need to improve the long-term weight and health trajectory, we should be exercising every day. At our clinic, we advocate walking as the best exercise. This is healthy for us. It's something doable for most people. It's lower impact, so we're less likely to get injured. And so if you're not doing that already, I would advise that you make a plan right away to begin walking every single day, 7 days a week. And if it's only starting with walking down to the mailbox and back, so be it, but gradually build up your time, your minutes, listen to podcasts, walk the dog, find friends, whatever it takes, but getting out there and doing more exercise, more walking, more activity every single day is better. In terms of the medications front, we saw the FDA approvals of a whole sort of new class of drugs. And so you may have heard of these. The most famous one is probably Wegovy. There's Mounjaro. There's quite a few trade names. There's probably 6 or 7. And they are all activating the same hormone. And so if you've heard of this, you've heard of Hollywood stars using this. They are almost all generally injectable medications. What's going on there is that these are all Me Too drugs around a single hormone called GLP-1. And this is really taking a page from metabolic surgery, because metabolic surgery works by activating some key hormones that help reduce hunger, increase metabolism, lower body fat storage, lower long-term blood sugar. And one of those key hormones is GLP-1. And it goes up after gastric bypass surgery, it goes up after sleeve gastrectomy surgery. It's probably one player in the long-term success of those procedures. But it is now something that can be mimicked pharmaceutically by the drug companies having invented what we call GLP-1 agonists. It just means that it mimics the effect of increased GLP-1. And so these drugs have been quite helpful, actually. They are better, seemingly, in the published data, probably twice as good as the prior generation of drugs, which include some somewhat helpful drugs, including Contrave and Qsymia and a number of the prior generation of medications which we continue to prescribe. So what's the downside? Well, the downside is that this new generation of injectable medications, by and large, and certainly in our world, in our jurisdiction in Northern Nevada, are not covered by health insurance plans. And so, yes, there's sort of a grim irony here that we have the number one health problem, the number one cause of early death, and number one cause of disability and morbidity among humans is not covered when we have good treatments by the health insurance industry. That may change slowly, we may get a little more traction, but right now it's pretty frustrating because while we prescribe these medicines on a daily basis here at our clinic, we also advise our patients to go to the pharmacy and check it out, but in almost every single case, they are told that it's quite expensive, somewhere in the neighborhood of $1,200 to $1,400 for a monthly supply of the medication. So that's a little frustrating, but it is an improvement. So for people who are able to access it, those medicines do seem to make a difference. We're seeing, 7, 8, 9, 10+% body weight loss with those medications. You might rightfully ask, are there a lot of side effects? The answer by and large is no. It can cause some stomach upset, some fullness, nausea, things like that. These are just the side effects of GLP-1. They can slow down the stomach emptying. Some people can find some discomfort, but honestly, the side effects are pretty few and far between since it's activating a natural hormone. But is it a long-term solution? Well, we also think that once a person stops that medication, that we're likely to see the weight resume and head right back up, because we're just fighting these same features of biology, this sort of internal programming of the body weight set point. So while a person is using them, helpful, absolutely. It's very likely, and I'm sure the studies are going to eventually show, that if you keep on them, you have to keep on them, otherwise you can expect the rebound weight gain to occur. But nonetheless, that's somewhat helpful. And so we do pair, diet and exercise advice, like I mentioned, with the medications, and also dealing with other aspects that can impact weight and maladaptive eating or consuming the wrong kinds of foods. That can involve working on the psychological front, the mental health front, dealing with stress, anxiety, depression, eating disorders. Those all remain a very high priority to continue to focus on and try to improve. And then lastly, on surgery and on procedures, what's new there? Well, I would say that there continues to be some moderate use of the intragastric balloon in terms of non-invasive or less invasive procedures. And so the balloon is placed, just to kind of recap, if you're not familiar, is placed with an endoscopy. The balloon stays in for 6 months and then it's removed. There are some other variations of this around the world with some different balloon types that have been approved. They sometimes have come off the market, but by and large, that's the most common strategy. And yes, people do tend to lose a significant amount of weight during that 6 months. People can get traction, make those same behavior changes, diet, exercise, etc., and keep that weight off for some time. I saw a patient recently who did fantastic with it, and 5, 6, 7 years later, finally the weight has been regained. Of course, people always blame themselves, but really this is, again, just biology and programming, genetics, plus the environmental influences that are causing that set point of body weight. We can fight it to some degree, but we shouldn't blame ourselves overly when we lose that battle due to the biology. But it could be done again, and so this non-invasive balloon treatment, does have usefulness in that way. Once again, though, the problem we run into is expense, because once again, it's not covered by health insurance plans, and so it's a pretty costly procedure in the neighborhood of probably $10,000 all in for a person to have to pay for out of pocket, including the procedure to place it, the procedure to remove it, and the facility fees, etc. So helpful, not the world's best, but we're happy to have any arrows in our quiver against this very formidable, troublesome problem of obesity and its corresponding health conditions like type 2 diabetes. I would say that there have been a number of other also similarly less invasive procedures that we have investigated and performed and been a part of quite a bit over the years, but there's really currently none that I personally would endorse right now. There are still some people who are enthusiastic about endoscopic suturing and tightening of the stomach. We went through an enthusiasm for that ourselves approximately in 2016, 17, 18, and then we found that the data was not very compelling, and so our enthusiasm has waned since then, although you may see it being somewhat more positive in the minds of some people around the world. We think that's going to play out to be not as effective over the long haul. And then surgery, of course, if you've followed any of our work here, you know that surgery, we think, remains a very important mainstay of treating obesity and type 2 diabetes and sleep apnea and cardiovascular disease and all of the obesity-related complications. There have been more and more studies that continue to reinforce the fact that after bariatric surgery, people live longer and they have gigantic health improvements and significant risk reduction on the whole. They have lowered risks of cardiac disease, neurological disease, stroke, heart attack, diabetes, and many other adverse health outcomes. We continue to see the dominance around the world and in the United States on sleeve gastrectomy. There have been some technical improvements that may be continuing to improve the sleeve gastrectomy outcomes, although it remains very safe, extremely effective, and among the safest 45-minute procedures done in all of surgical suites around the country. Gastric bypass remains important for treating sometimes as a revisionary procedure to the sleeve, and sometimes for people who have very severe acid reflux. Duodenal switch or SADE procedures also are playing a role in a minority of people as a revisionary procedure, or in some cases as a primary procedure for certain individuals. We don't see much activity still with the laparoscopic adjustable gastric band, as that kind of faded into a very small fraction of people. I would say one other development is that we've seen increasing success with revising prior gastric bypass surgery or other prior bariatric surgery. We have been part of a pioneering effort to improve the revision procedure when people have previously undergone gastric bypass specifically. And so that's gradually been sort of perfected and honed down to a procedure that can be done safely with a 45-minute laparoscopy that's extremely safe, but it is recreating the bypass in a way that jumpstarts and refreshes all that favorable hormonal physiology so that people enjoy a very significant long-term weight loss following that revision procedure, and we see that same reduction in risks and diabetes and so forth that we saw with the primary procedure. And so that's been something that's been gratifying and is really sort of coming into its own now in 2022, and we expect to continue going forward. So what's on the future, what's in the horizon? I would expect to see that we're going to see greater adoption of the use of the GLP-1 medications I mentioned. I hope that we'll see the cost barriers come down so that more people can take advantage. I think we'll continue to see adoption of the few pockets of health insurance plans that don't cover bariatric surgery or metabolic surgery. I expect that we'll see those barriers continue to fall so that people can gain access through their health plans to what is among the most effective, safest medical interventions around all of medicine and surgery today. I think we'll continue to see metabolic surgery be used as a primary treatment for type 2 diabetes, and even probably expanding into more pre-diabetes in appropriate individuals. And I think we'll continue to see some innovation, at least in terms of some of the technical aspects, particularly of sleeve gastrectomy, as we have some improvements in the technique, some of the things that are sort of insider baseball for the surgical community, but do have some long-range health improvements and reduction of side effects for people undergoing the procedures going forward. I don't expect other wholesale changes, but you never know in 2023 what we'll see. There are many other candidate hormones that we know are changed, either increased or decreased following sleeve gastrectomy or metabolic surgery. And so we are likely to, at some point, see drugs starting to move through the regulatory pipeline that are taking another page from metabolic surgery, and that are going to mimic some of those effects, so that we might see more pharmaceutical treatments for obesity going forward. We're no closer, I don't think, to really wholesale societal changes for prevention of the problem. We have a long way to go to change things in the agricultural practices and really understanding the genomics and the environmental influences of obesity. So unfortunately, I think that may be a decade or multi-decade problem, but hope springs eternal. So that's just my roundup summary for the beginning of 2023, and feel free to show how wrong I am later in the year and what I've gotten wrong and right. But I wish you the happiest of New Year and the best of health.